Something that we've been looking at over the past 5 years is exploring different ways to deliver healthcare. Traumatic brain injury takes a lot away from the person. Their identity can change overnight. So they might go from somebody that's very successful in their career, that's the breadwinner of their family, and then overnight they have to adjust to the fact that they can't return to work, that they can't perform the role in their family like they used to, they can't be there for their children. And so it's a really difficult thing to overcome. And we don't feel that people can overcome that by just having support from one-to-one hospital-based settings. And there's lots of research now that shows that social integration plays a big part in someone's physical and mental health. And so we need to be thinking about the future.
The project that we have become involved with in setting up the work with the brain injury colleagues has enabled us to look quite closely at different ways of doing things. We can use the combined talents really to do something quite unique, and the POND project really was the culmination of lots of different ideas about how we might work together. We know there's lots of research that says that the spaces that we work and live in can have a big effect on our well-being, and the Academy sits right next to a large open space that is rather overlooked and neglected, and we thought we could use the opportunity to refurbish that space and regenerate the well-being spaces around us to help the traumatic brain injury patients, to bring our academics in as part of that project.
Down to Earth has been working with Traumatic Brain Injury Service for about 4 or 5 years. They've come on lots of different projects, and the impact on participants when they come along is really remarkable. It's about people being together, doing something together, and that's what brings about the positive change in people's lives. It's about people learning about self-belief, it's about learning confidence, about learning new skills, and you can see the change in people very quickly. When we're working with the traumatic brain injury team, one of the things that's really important is that people have lost a lot of who they are after their injury, and so giving opportunities like this allows people to regain that confidence and that sense of self that they've lost. And you can see the change in people within days. You know, this was a very short program. This was only 4 sessions with 3 groups, and the changes in people were really remarkable. You could just see them growing, you could see them realising their value again. And it's not anything that special that anyone's doing, it's just a chance to be with other people doing something that's important, that makes the difference.
Hopefully, if we can prove through the research that we are engaged in through this project that these initiatives work, we can grow that with our partners to develop other wellbeing initiatives and hopefully make a real difference to the people that are involved.